Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to our Monday Q&As. This is the place where I answer your direct and specific questions. So if you have a question for me, please feel free to email it info@drzphd. The email is in description box below. If for some reason your question is not something that I'm able to generalize, I will let you know and respond via email, letting you know that I can't answer that in Q&A. But other than that, I'd say 99% of the time, the questions are able to be generalized to the public population, to the general population. So having said that, I have, as always, selected 6 random questions for today from the Q&A folder. I have blacked out everybody's names to maintain your identities confidential. And I have included timestamps below in case if you want to jump around and look at different various topics that are of interest to you. Having said that, let's get started. First question for today. Hey, Dr. Z, I have a problem. I don't know if I want my family in my life for my transition, and I'm afraid to give them a chance. Both of my parents have mental health problems and can be very self-centered. As a kid, I was left behind in terms of my place in the family system and often subject to being teased for doing things that were deemed out of line. I quickly realized that I needed to suppress how I expressed myself to survive. One incident that stands out in my mind is that in 3rd grade, I really wanted a wig. In my mind, I don't think my thought was that I wanted to be a girl, but nonetheless, wigs fascinated me, and I very innocently asked for one. On my birthday, surrounded by all of my family, about 20 people, I opened up the box and got the wig. My mom got it for me and was being supportive in this instance, but it wasn't well thought out, as everyone erupted in laughter and relentlessly teased me over it. My narcissist father definitely got a few punches in too and still tells this horrifying story to this day. I'm now realizing how ashamed the story makes me feel to this day, and I'm tearing up vocalizing it. There were many incidents along similar lines, often around teasing my creative projects. I learned to hide and to gray rock as to not get attacked. I work in a creative industry now, but have major imposter syndrome and can't even imagine how much of my potential I'm missing out on because on how terrified I am of expressing myself. I'm self-expression repressed rock on the outside, and on the inside, I'm a punk and goth girl with insane amounts of jewelry, accessories, and wild makeup. I love your internal self. I'm ashamed of this part of me and hide it. I don't know what to do. Deep down, I just want to cut everyone off and finally be free, but I haven't because I think in their own way, they care about me. So this is a very tough situation because you have a conviction that your family cares about you. You seem to care about your family. And yet you also describe them as not perhaps being maybe the most supportive individuals for you. Perhaps your family is not the most supportive environment for you. So what to do in the situations when you want to express your family, but you feel like you're not going to get the support. You feel like perhaps they're going to continue to tease you, make fun of you, or just be verbally mean or cruel to you. You know, one of the things I got to say is a lot of times we make decisions to hold ourselves at bay because of our parents. And every one of us was a child, and every one of us continues to some degree maintain a childlike qualities, meaning still striving and wanting that unconditional love from our parents. And a lot of times we put who we really are on hold because we're so afraid to disappoint our parents. The truth is, our parents one day die, and we have to do the rest of the living by ourselves. And by that time, it becomes very stark awareness and realization that this life really is for you. Your parents have their life, it is there for them, and this is your life, and it is for you. And the lesson every parent needs to learn, in my opinion, is how not to project what they desire their kids to be, but how to love their kids unconditionally, regardless of how they end up growing up to be. So by not being your authentic self, you're robbing your parents of an opportunity to learning that lesson, and you're robbing yourself of an opportunity of becoming a happy, creative individual with insane amounts of jewelry. Hey, totally hear you on that one. Which reminds me, I haven't got any chunky jewelry in lately, and wild makeup. I would encourage you to think about yourself and see how you can start slowly bringing yourself into this life, how you can start slowly allowing yourself to show up and owning who you are, and not be afraid what your family environment, what your parents say. And also parallel to that, start cultivating your own support system of people who are going to love and care and support you. That's what I would recommend for you to do. And also to just consider this idea that one day your parents will die and you're going to have to live the remaining of your life. And it's going to be a very painful realization that, oh my God, I lived all this life pretending to be somebody I'm not. For what? For whom? So just think about that. Question number 2. Regarding your video on living a double life to deal with gender dysphoria, I have a video on is it possible to live a double life, where it says that it's not sustainable. You can carry it for some time, but it's not long-term sustainable. I don't know if I can claim a double life. It felt and probably looked that way, and maybe it was, even though I told my ex-partner since before we got married and during the marriage that I was trans. She withheld that she was a cancer victim and was on the cluster B spectrum until much later in our marriage due to a relapse of the cancer and her PD, I think PD means personality disorder, affecting her ability to work. At the same time, I'd cross-dress in secret, and necessarily because it was, I'm sorry, I'd cross-dress in secret, not necessarily because it was a shameful secret. So in some ways it was, but I could never get her to acknowledge what I was without having to face accusations that the up 10th time I've raised the subject was a very fine time. Was the very first time. I apologize. The font is very small and I think bifocals, time for bifocals. In hindsight, it seems that both of us had suspicions about what was going on the head of the other, and adversely affected our marriage in the long term. Sorry to hear that. Is it possible to speak to having gender dysphoria while one's intimate partner has issues that aren't gender dysphoria of their own? And what can such partnership do to make their coexisting issues work better together or even support each other? Can two or more people with diversity of issues between them even be helpful to each other? Yes, I think absolutely they can be. I don't think it's an issue that two people have issues of their own that they're struggling with. I think the bigger issue is how transparent, how open they are about what their struggles are, and how willing they are to ask for assistance and for help and for the support. In your case, it sounds like your partner withholds from you that she has mental health diagnosis that she's been struggling with, and have also not disclosed to you that she has a history of being a cancer survivor. And you have also, although you said you've been upfront, you also continue to do some things in secrecy. So already there's a relationship that is not built on trust, right? When two people are disclosing things from each other, they're already eroding trust, which is essential, which is the screws. I would say trust is like a centerpiece of any good relationship. But is it possible for two people to have issues of their own and support each other? Absolutely. Again, as long as they're open about it, and it all depends on the extent of their support to each other. In fact, oftentimes, two people going through different separate issues together can be very helpful because they can resonate on this personal level of bonding and connecting, that they each have their own mountain to climb. And that, in fact, tends to bond sometimes people versus drawing them apart. So yes, absolutely it is possible, but it all has to be built on trust, on transparency, and on really good, effective communication between the two individuals. And sometimes when we're in a relationship and that has been eroded, it can be very difficult to impossible to bring that back. So I wish you all the best, and I'm sorry that has happened in your relationship. Question number 3. Hello, Dr. Z. I have been working with a therapist in my area, and we have concluded that I am experiencing gender dysphoria. It's clear that I'm uncomfortable with my gender assigned at birth, male, and have been for quite some time. The problem is that I don't have a clear sense of my actual gender identity. I've experimented with my gender expression, clothing, pronouns, etc., both privately and socially, and it still isn't clear to me. All I know is that I'm uncomfortable with my body being male. This makes me nervous to start hormones or to take other steps to alleviate gender dysphoria. I don't know what to do to move forward. Should I have a strong, solid sense of my gender identity before making any big decisions? Any wisdom you might have would be greatly appreciated. P.S. I greatly appreciate your YouTube channel and all of the work you have put in the over the years. So this is a really good question. So the question is, I'm in therapy with a therapist. We have concluded I do have gender dysphoria. I feel uncomfortable with my gender assigned at birth. I feel uncomfortable with my body. At the same time, I still don't know exactly what gender identity resonates with me. I don't know exactly where I land with that. Am I transgender? Am I non-binary? Am I gender queer? Am I gender fluid? And have done social transitioning, which would be something that I would recommend, and still not really sure where I land in the spectrum, and feel hesitant to start medical intervention in the form of hormones. My suggestion would be, if you feel hesitant to start medical interventions, because you're just still not sure where you land, I would say that still warrants something there to investigate. Meaning, it's one thing when you know, or at least have a sense of what your gender identity is, and you then have further an understanding of what the hormones are going to bring to the table. Are they going to alleviate dysphoria, and are they also going to help me with secondary sex characteristics in order to bring congruency to my authentic gender identity? It's another thing when you still don't even know where you land on the spectrum at all. I recommend to at least have some sense where you lean on a spectrum before considering medical interventions. You don't need to have a 100% solid sense of identity. Nobody, I mean, I don't want to say nobody, some people are 100% sure, but not everybody is 100% sure that that's their gender identity, but they do have a sense. They do have sense, and they know what resonates with them, and they know what feels right for them. Even though they might not be 100% sure, they have some sense. Versus, I still don't even know what my gender identity is, other than I'm not comfortable with my gender assigned at birth, and as a result, I have dysphoria. So I would encourage for you to dig deeper, work a little bit deeper. Sometimes social transition, trying all those things may not be enough. Sometimes it's more asking the right set of questions especially from your therapist, about all of the nuances that are underneath one big umbrella of gender identity, such as even gender role, gender expectations, gender expressions, and asking you all of those vital questions and paying attention to your responses and paying attention to what comes up. That's what I would recommend. So when you really don't know at all what your gender identity is, I just, in my opinion at least, and it's okay if people disagree with me, I don't see the reasoning going in the medical interventions, because you may start having secondary sex characteristics that are irreversible, that down the line, once you do figure out where you land on the spectrum, may not be what you have wanted. So it's best for you to have some sense than do it this way. So that's what I would recommend. Other people, please chime below and share some of your thoughts, some of your insights. But this is a really good question, and I wish you all the best. Question number 4. Hello, love your videos. They're very informative and help with some questions. You are so welcome. What I would like to ask is this: is it uncommon for 47-year-old to feel like they have been living a lie most of their life? For the person to recognize that they are probably transgender and still living the same life, just existing. I know from about the time I was 8, I was not like other males and I've hated living a lie, but I come from a toxic family that if I were to transition, I would not be accepted. But I would like to know, will things get easier to stay living a lie, or is it all just means to an end? And the only true way to have comfort is to just look at the easy way out, even though I do not want to go the route. Okay, so I'm trying to fully understand grasp this question. So, um, is it uncommon for 47-year-old to feel like they have been living a lie most of their life? I'm assuming what you mean by that is you're 47 years old and you pretended to be your gender assigned at birth, or at least living your gender assigned at birth, when all the way on the inside, you have completely different authentic relationship to your gender. Like you said, you for the person who's recognized that they're probably transgender and still living the same life, just existing. To answer this first question, it is incredibly common, very, 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 very common, unfortunately, for people to come to a realization that they've been living life a lie, that that's not really who they are. And it can be a very painful realization and a very stark one. Your last sentence got me a little confused. What I would like to know, will things get easier to stay living a lie? So will things get easier if you continue to live your gender assigned at birth, even though you struggle with dysphoria as a result of it? In my experience, no, things don't get easier. In my experience, people tend to, things either get, um, they stay the same or they get worse as people get older, because oftentimes as we get older, we get more, we start asking ourselves more spiritual life questions, such as, life is too short. What is the meaning of life? Did I really live my life truly happy? Did I really get the most out of my life? And those type of spiritual questions as we get older are the ones that push us to really reevaluate our relationship with ourselves. And as a result of that reevaluation, a lot of individuals start to experience increase of dysphoria, because then they have to confront who they are even that much more. And then you say, something to just look at the easy way out, even so I do not want to go that. I don't know what's the easy way out. I think you mean this is the easy way out, just continue living a lie. I don't think it's an easy way out to continue living a lie. I think it may seem, this is what I see. For a lot of people, it may seem like it's easier way out because you have accustomed to coping in this way. So you tell yourself, I'm already accustomed to being this much in pain, and I'm already accustomed to deal with it. Once we get accustomed to pain as human beings, we tend to forget how painful it is until we reach another level of pain threshold. This is just how we are. So our mind starts telling ourselves all those bullshit lies that this is not so bad. You don't know how bad it is until you actually start doing something about it. And once you start doing something about it and it lifts your distress, then you realize how much pain you've been actually feeling and suffering all of this time. So you all know me. I think that being as close to yourself, being as honest with yourself is important. I also think that life is too short. I think that when you already know you have dysphoria and you feel like you've been living a lie, to continue with that thought all the way to your last day, I think that's a very painful and heavy thought to carry. And I wouldn't wish for anybody to carry that thought. So I would really think about that and consider, my God, you're only 47 years old. So consider what's stopping you. I also would encourage for you to consider this. You know that life as it is is going to continue as it is if you don't do anything about it. So you already know the amount of pain you're going to feel. But what you don't know is opportunities everything else might bring to you. Isn't that worth it? Isn't that worth exploring? So I'd encourage you to consider that, and also to consider yourself, and most importantly, consider how much living with gender dysphoria over the course of a long period of time affects your overall well-being, not only psychologically, but also physically. So I really encourage you to think about that. But you're not alone in this boat. A lot of people feel exactly the way you do, and then they decide to do something about it, fortunately. So I really hope you'll be one of the person who decides to do even something small about it. And I wish you all the best. Question number 5. Let's see. Hi, Dr. Z. Thank you again for all you do. You are so welcome. I had FFS early July, and as the swelling goes down, I love the results. I'm so glad to hear. Congratulations, by the way. I'm glad you're loving the results. Since then, I have had my consults for breast augmentation and minimal depth vaginoplasty. Breasts are being done week after Thanksgiving, and bottom is early March. Before FFS, my dysphoria was horrible with facial features till I looked for the first time in the mirror, and by the brow bone went flat, and the relief I had, even though I was few hours removed from surgery. Oh, that sounds like you had an immediate alleviation of distress. I'm now getting the same dysphoria over my breasts, even though I'm a full B and my genitals too. I broke down into tears last night. I still have a penis. What can I do up this next 6 months? So the next 6 months aren't so miserable. I know the past year and a half of transition has flown by, but this dysphoria is relentless, day in and day out. Luckily, I have a therapist I see every 2 weeks, and we also have lots of other things that we cover as well. However, I would do all that all over again, because living unapologetically authentic and actually wanting to live life, it is an amazing feeling. Just need to get through this short period of time. First of all, congratulations again, and your words are testament to the person, the 47-year-old person who asked me a question above, and to the very first question we had here on Q&A, to how much better you feel and how much happier you feel once you actually take control of your life and you start doing something about dysphoria. Now, sounds like this video is coming out in October, so you have even less now wait for breast augmentation is coming out for you next month. But what to do to alleviate this dysphoria? The dysphoria can a lot of times increase right up to the surgical dates, because now that it's so close to the surgical dates, your mind is overemphasizing the distress, meaning you are hyper-focusing on the body parts that you're going to alleviate with surgery. You're also hyper-focusing because you already had facial feminization surgery. So as a result of having facial feminization, you already know what benefit it brought you immediately. So now you're placing those expectations, the same expectations that the facial feminization gave you, onto breast augmentation and vaginoplasty surgery as well. And you're hoping they're going to alleviate the distress. The more you think about it, the more you have to focus on the body parts you're trying to modify through the surgical care. And as long as you do that, your dysphoria is going to go up because you're thinking about it. You're putting energy, you're spending your mind energy on thinking about that. And anytime we give our minds energy to any thoughts related to dysphoria, we're feeding it. Think about gender dysphoria as a monster. Every time you think about how uncomfortable it makes you feel or about a body part that bothers you, you are spoon feeding the monster, and you're spoon feeding your thoughts are equivalent to something that is very high in fat, very high in sugars, very high in everything that we consider in society yummy, everything that hits those taste buds. And unfortunately, in this case, what happens is that this monster likes it so much, it wants more, and then it asks more, and the cycle begins to grow, and the monster gets fatter and fatter. So what I'd recommend first and foremost is try to notice when you are thinking about it, and try to reframe and try to reroute yourselves to think about something else. Find ways to distract yourself during this period of time. Tell yourself you have X amount of time before surgeries, and the surgeries are going to happen. They're happening. In the meantime, you're going to focus all of your thoughts and energy on obtaining another goal. Set yourself another healthy, realistic goal that has nothing to do with dysphoria. Maybe your goal is going to be, I don't know, reach some level of productivity at work. Maybe your goal is going to be to start daily meditation practice. Maybe your goal is going to be read one book a month. Whatever your new goal is, set that goal and try to focus your thoughts on that. Because remember, the closer you're going to get to the surgical date, the more your dysphoria chances are might be. For some people, it's the opposite. Actually, the closer they get to the surgical date, the lesser they feel dysphoric because they know they're about to take care of that issue. But for some, depending on how your mind operates, your anxiety levels, your tendencies, your predispositions, that might be the case. So that's what I recommend. Don't spoon feed the monster. Put all of that energy into something else. But yeah, sounds like you're just around the corner. When the video comes out, you're just going to be a month before your breast augmentation. And then from there, before you know it, it's going to be March and you're going to have vaginoplasty. I wish you all of the best. I hope you're going to have a wonderful recovery. I really hope you're going to love your results. And I really hope they're going to alleviate all of the distress you're feeling once and for all. Yeah. So wish you all the best. And what a beautiful thank you coming to you, circling to conclusion toward almost the end of the year. So wish you all the best. Final question for today, question number 6. Thank you, Dr. Z. I'm a trans woman that transitioned 5 years ago. I also had FFS 5 years ago and started hormones 6 years ago. I'm happily married for 28 years. Congratulations. That's beautiful. My lifelong friends are still in my life. I blend in the world very well. My question is, why do I feel disgusted with myself? I actually feel worse at times than I did before. I love being, I crossed out, I think this viewer mentioned their name. Yes, I remember now. You mentioned your name, so I crossed it out for privacy. I love being, let's just say me. I love being me, but hate that in order for me to be me, I have to be trans. I constantly go back to presenting as a guy for a few days to try to not be trans. Wow, you do that? After, I'm sorry, I'm just very surprised. 5 years, you had FFS, okay, and 6 years on hormones, but it never works. Okay, yeah. It's not meant to work because you're not a guy. I feel horrible that I look like a guy, I'm sorry, and others see me as a guy. I go back to processing as me, to presenting as me, and a calm runs through me. Okay, that calm that runs through you is an indication. That's an indication that that's who you are. It upsets me that you try to present as something you're not at this point. That's psychologically is not going to be the best thing for you that you're doing. Please don't do that. I feel ashamed to the people of society. I feel ashamed to the people of society. Really? I wouldn't worry about other people of society. That in order for me to feel better, I have to pretend I'm a woman. No matter how my brain was formed, I was still born male. I knew going into transitioning that I could never be a real woman, and transitioning was a way to manage my dysphoria, kind of like insulin in a way to manage diabetes. I just wish I could be comfortable in my own skin and not feel this way. Sincerely. Oh, my heart goes out to you. You're expressing so much internalized transphobia, so much internalized self-criticism, and so much internalized shame toward who you are. It is very clear in here how much you're struggling to fully accept and have ownership and sovereignty and power over who you are. And I think in this case, your mind and the way you're thinking and the way you're perpetuating thinking about yourself is your enemy. It is not the world in this case. It is not what society thinks about trans people. It's you in your mind. I'm sorry to be such an asshole, but a lot of times it is us and our minds that jail ourselves in our own thinking and become prisoners enslaved within our own mind. At what point do all of us stop trusting ourselves? Look, you try to present like a guy, which you're clearly not. And the minute you go back to presenting as yourself, you feel calm running through you. What happened to you trusting that? What happened to you trusting that sensation? That is a body response. That is just spirit response. That is your soul response. That is collective response of every cell in your body trying to communicate something to you. You're not listening. It's trying to say, this is who you are. This is who you're meant to be. This is your blueprint. But I think you're struggling because the minute you feel it, you don't allow yourself to internalize that feeling and to accept ownership over who you are, because your critical mind gets in the way. And then you start feeling ashamed of yourself. Like you said, you feel shame that in order for you to feel better, you have to pretend to be a woman. This is what I hear is how you think about yourself. So first and foremost, you don't think that, there's just very strong gender concepts that are tied and anchored to ideas of sex. And this is what keeps you enslaved and caged. And that's just really brutal. This is complete masochism, complete self-abuse that is not necessary. There's so much you can do. There's so much work you can do at this point to work on cultivating self-love and acceptance. And I'm not talking about fluffy bullshit self-love, I'm talking about genuinely self-loving yourself and deconstructing these notions and ideas you have about yourself. All of the notions and ideas we have about ourselves are just that, they are ideas. They're scripts we run inside our headspace, and they're scripts that at any point in our time we can delete. We can, just like I retracted your name, we can retract with a black marker. We can rewrite. We can create a new story. But we don't believe we can, because by this time, some of the scripts become things we feel are the truth and value points and things that are dogma, but they're not. And you have a choice. So you have a choice to either work on yourself and detox your mind and detox internalized transphobia. It detox how you think about yourself and allow yourself to feel what you're already feeling, the sense of calm, and start trusting what those feelings are telling you. And I really hope you do that. I really hope you spend some time to work on yourself and perhaps maybe find a therapist you can work through this to cultivate confidence and sense of self-worth, because it pains me to see if you're going to go live thinking this way about yourself. That is a very harsh way to think about yourself. I would love for others to chime below and share with you if they felt the same way, what was helpful to them. But this type of thinking, it doesn't benefit anybody. It doesn't benefit you. It doesn't benefit you, people surrounding you. It just slowly eats at you from inside like cancer. And it's so not worth it. And before you know it, you're on a deathbed, and then you realize that all of the thinking was just it's bullshit. It was a matter of modifying it. And you can modify it. And I really encourage you to do that. So I hope other people are going to comment below and share some of their thoughts on how and what was helpful for them to detox their internalized transphobia. And I really, really wish you all the best. And I really, because this is so painful, I really wish you would recognize how much it pains me, an outsider, to read it. If I feel so much pain and empathy for what you're thinking inside of your headspace, why can't you feel the same pain and empathy for yourself? So I really wish you all the best. God, what a touchy, heartfelt group of questions. Comment below. Feel free to email your questions to info@DrZPHC. The email is in the description box below, and I will see you all next time. Bye.